I'm really excited to discuss the study, Prophylactic Use of Compression Sleeves Reduces the Incidence of Arm Swelling in Women at Risk of Breast Cancer-Related Lymphedema, a randomized controlled trial. This study was published by Dr. Vincent Paramanandam and his associates. It was published in the Journal of Clinical Oncology in February of 2022, and it is a single-blind randomized controlled trial that was performed in India in 2018. The purpose of this study was to determine whether prophylactic use of compression sleeves prevents arm swelling in women who have undergone axillary lymph node dissection for breast cancer surgery. So this is a great advancement in recent times because current guidelines focus on early detection and prevention of progression of disease. They're not really looking at prevention of disease. When the study was published, 301 women were included in the study who were all over 18 and all had axillary lymph node dissection. The study began day one post-op, but initial measurements were taken preoperatively with a bioimpedance spectroscopy device. So this is the LDEX device that measures total body water and can detect differences in fluid levels as little as 2 tablespoons of water. So getting baseline of the total body water in each arm, as well as what was intracellular versus extracellular being a measurement of lymphedema, were taken preoperatively to get baseline measurements. Now, the control group consisted of 149 women. They had one single group session, which included education about arm and skin care, drain care, as well as a basic shoulder exercise program. Our compression group was comprised of 152 women who all had the same exercise and education session, but were also given a 20 to 25 millimeter of mercury arm sleeve that they were supposed to wear from that first day post-operatively until 3 months after completion of treatment. They were to wear the sleeve a minimum of 8 hours per day and all during waking hours. Both groups were taught the signs and symptoms of lymphedema and instructed on what to look out for. The primary endpoint of this study was swelling levels based on bioimpedance spectroscopy. Girth measurements with a tape measure were also taken. It was found that swelling occurred less frequently in the compression group, that being 58 of 152 women, or a percentage of about 38%, versus the control group who experienced swelling in 80 of 149 women, or about 54%. When all of the outcomes and measurements were taken into consideration and finalized, it was seen that 42% of women in the compression group got lymphedema versus 52% of women in the control group. Swelling also was delayed and occurred later on in those patients who wore the compression sleeve in the compression group. Quality of life scales were also measured, and there was no difference in women in either group. Therefore, it was found that wearing a sleeve did not impact quality of life in these women. All of the measurements were seen both with bioimpedance spectroscopy as well as with girth measurements with a tape measure. Some interesting points to consider when looking at this study. All of the women had different cancer receptor status, were staged differently, underwent different surgical interventions, for example, mastectomy versus lumpectomy, and they all had different BMIs. The median number of lymph nodes removed in the control group was 18, whereas the median number of lymph nodes removed in the compression group was 19. So a large amount of lymph nodes were taken out in both groups of women. Additionally, there was a varied number of lymph node involvement in both subsets, and there was no difference in women who received taxane-based chemotherapy versus those who obtained non-taxane-based medications. So this is a very important study, in my opinion, showing that wearing a lightweight sleeve for at least 3 months from day one after surgery can actually prevent and delay onset of lymphedema in many of our breast cancer patients. I strongly suggest you share this information with your care team, with your friends, and with any patient who is concerned about getting lymphedema. I think this is a great start. our female patients can feel very confident and secure that they are doing everything possible to potentially prevent lymphedema simply by wearing a sleeve. I promise to keep you updated on more exciting information as it becomes available, and I urge you to stay lymph smart.